Aloha, this is Everyday Wellness and I'm Dr. Lisa Kim. We're here today joined by Dr. Kristen Coles. She's a naturopathic physician and a licensed acupuncturist. Welcome, thank you so much for coming. Okay, great. Well, today I would like to discuss about natural alternatives for pain management or pain treatment. So can we start with the pain cycles and how the inflammation occurs in the body?
Yes, when we think about pain, what most of us think about is right away, how do we get out of pain? Because none of us like pain.
Right.
And we'll get to that, don't worry. But let's talk a little bit about why we have pain and how pain happens in the body, because that will be a good segue into some of these treatments and why they can be so effective for pain.
Okay.
So we have a number of different types of pain that we can experience. And we can have pain that are migraines, we can have pains that are aches and pains, we can have things like abdominal pain. What we're going to talk about mainly is musculoskeletal type pain today.
Great.
And we can have acute pain, we can have chronic pain.
Right.
And acute pain is something where, we slam a finger in the door and instantaneously we feel a lot of pain.
Right.
And we can get swelling, we can get redness, we can get bruising, and that can all happen very immediately. And half of that pain is the fact that there's been a physical trauma to the body, and we then think, what are the things that sense pain? It's actually our nervous system.
Okay.
So pain really begins in the nervous system, and the nervous system is our peripheral nerves that have a contact to the brain. Okay?
Right, right.
And that acute pain is mediated by inflammation. Because we have a trauma, we have the release of a bunch of different chemicals, we have sometimes the breaking of blood vessels, which causes bruising, and then we have all of those that sense on the nerve that there should be pain, and it tells the brain so that we know if we put our hand on a hot stove, we actually have heat sensors, but they show up as pain so that we know to pull our hand away. That's why we have pain. It's an adaptive type of response so that we can actually survive. It's a survival response.
It's a pretty phenomenal mechanism, yeah.
Exactly. That's acute pain. And that's a good type of pain to have, because if we didn't have that pain, there are some people who are genetically born without pain sensors, and they put a hand on the hot stove and they never feel that their flesh is burning until they smell it.
Right.
That's not good. So acute pain and those signals is a useful thing to have. When we get into chronic pain, that is more of a maladaptive or an improper pain response, and that is where a lot of people end up in our offices because they've been in chronic pain, and chronic pain is pain that has lasted for longer than 3 months. Okay, and it's a very different type of pain than the acute pain, and there's a very different type of cycle that's occurring in the body to mediate and tell us that we have this pain.
Okay. Can we go over the threshold person, each individual person may have, to pain? Because some people, just a little tiny bit in pain and they are in pain. And versus other people, they may not even know that they're in pain. And they just keep going on and on and on until, one day they're like practically broken. And then they realize, oh, I'm in pain. I need to get some care. But by the time, maybe a little too late.
There's a lot of interesting research into this, actually, and a lot of the research is focused on high intensity endurance athletes. And these athletes who are doing our major triathlons and major endurance type training, what they've found in the research is that these people genetically have larger nerve sheaths. So the nerves in our body, they all run in a little casing, and it's called a nerve sheath. And all of our nerves have a nerve sheath, and that's what they run in. And it differs individual to individual to how much room is in those nerve sheaths.
Interesting.
Okay. Exactly. If we have a lot more space inside there, that nerve can actually expand and get a little inflamed, but not get squeezed. Okay, those people will not experience pain to the same extent as people who have a very, very tight nerve sheath already. The second they have a little bit of inflammation or expansion on those nerves, they will feel it. And that is a hypothesis that they've been looking into as to that difference in pain.
Okay, and so this would be more of a genetic factor, something you're born with, not necessarily that you develop as...
It is. It often is. However, the other piece to that is that the levels of inflammation, systemic inflammation, will also play a role there.
Right.
Because if we are chronically inflamed, which we've talked about in some previous episodes, there's a lot of reasons for that, but if we're chronically inflamed due to something in our diet, due to something in our environment, due to our hormones, we are already operating at a little bit of a expanded nerve inside that sheath.
Right. As a matter of fact, chiropractically, when I adjust my patients, I pretty much know as soon as they come in and lie down on my table, I put my hand on them and I hardly touch them and they're in pain. But many times, those type of people, they tend to have even the muscles, the tissues feel swollen because of the inflammation. It's really, really interesting. There's a different feel to it versus the people who just, you're saying that they may not feel the pain as much. Very, very different. The whole inflammation can change a lot about the pain perception.
Yeah, absolutely. I think that's you explained it perfectly.
Right. So we had a show on inflammation, and I hope our viewers can refer back to the inflammation show because it was such a great informative show about inflammation, and we had given some natural treatments to help with the inflammation. But could you talk about some of the natural treatment options for pain? And there's something that to me is almost miraculous that that you've been doing with Dr. Stillsmith.
Yeah, so at our clinic, we have been using a very specific treatment to get people out of chronic pain. And this treatment is called Neural Prolotherapy, or NPT. And it is a pain treatment that involves the use of sugar water, or dextrose, D5W, for those of you who are familiar with medical terms. And this is a medical grade sugar water. What dextrose does is it has a very specific role on our peripheral nervous system. And our peripheral nerves are all the nerves in our extremities. So we have a spinal cord, which is a main central cord that goes from the base of our neck all the way down to our low back. And off of that spinal cord, many, many nerves come off. And these nerves go everywhere in the entire body.
Even into the brains.
Exactly, everywhere. And so we have our central cord, which is our spinal cord, and then everything else is our peripheral nerves. And our peripheral nervous system is almost microscopic. You can't really see your nerves, you can't really feel your nerves until they get very inflamed. And then sometimes you can feel them in specific places, as you know. And those peripheral nerves have receptors on them. And a receptor is something that a molecule can bind to. Okay? We're going to put up a diagram on the screen. And it's a bit of a crude diagram, but I'm going to kind of walk our viewers through it so they have an idea of what we're talking about. Okay. So the brain is on the right side of your screen, and it has a long straight line, which is your spinal cord, and then segments, little lines coming off it that are our nerves. At the very bottom, there is a long nerve coming off. And on the bottom left of our screen, there's something called the TRPV1 receptor. And I actually just call that the TRPV1 receptor, The TRPV1 receptor has been highly studied for pain. This receptor binds to something called substance P. And if you've ever heard of substance P, or if you've ever heard of capsaicin cream being used for pain, it is acting on this pathway. Substance P stands for pain, accurately named. So this little molecule binds onto the TRPV1 receptor, and it sends a pain signal to the brain. Okay. So that receptor starts doing changes on the nerves, and then the nerve goes to the brain and tells the brain that there's pain. Okay. So what we want to do is we want to essentially change that chronic pain cycle, because once we're out of acute pain, we no longer have the trauma. We know our hand is no longer on the stove. It's 3 months later. Things should be healed.
Right.
However, in chronic pain, it has not healed, and people are still in pain, and that's an improper response, and it's largely mediated by the fact that our nerves are continuing to send a pain signal to the brain. Okay. Now, what we have, the image is gone.
Yeah, that's
so
okay.
That's okay. When we put the image back on the screen, what we have is on the top left, we have dextrose. Dextrose is our sugar water. And that little triangle goes down and it binds onto the TRPV1 receptor. And when that happens, substance P can no longer bind, and the dextrose changes the TRPV1 receptor to decrease pain and decrease inflammation. Now, how do we get the dextrose to the TRPV1 receptor? And that's the entire concept behind neural prolotherapy.
Okay.
So neural prolotherapy involves subcutaneous injections of dextrose. So subcutaneous means right under the skin, so just a little tiny bit under the skin. And we're actually using this sugar water, the medical grade dextrose, and we're injecting it in very specific areas of pain. Okay. So what we have learned through this technique, which was pioneered by an Australian doctor, actually, I'm sorry, he was from New Zealand, sorry, and his name is Dr. John Liftoff. And he has been in practice many, many years, and it was over 10 years ago that he started learning about the role that dextrose plays in pain. And then he started using this technique of injecting dextrose in certain areas where the nerves run, where there's pain, on himself and his wife, and then he expanded it to patients. He had a thriving practice of seeing a lot of rugby players, athletes, a lot of people who have injuries and then end up with chronic pain. And what we have learned is that there is a diagram of where nerves run in our body. That's something that we can learn anatomically. And there are very specific access points to these nerves. So for instance, let's say someone has ankle pain. When we have ankle pain, we can actually use this technique to change that pain by finding where the nerves that go to the ankle run. So there's specific spots behind the knee, down the leg, and along each side of the leg that goes right to the ankle. And those nerves will often be inflamed, and they will be sending a chronic pain signal to the brain. This type of pain is called neurogenic pain. Pain that's arising from the nerves. The research has shown that about 90% of chronic pain has some degree of neurogenic inflammation and pain.
It makes a lot of sense.
This is why NPT is one of the most successful treatments I have seen for pain. It can help 90% of people get out of chronic pain. Yes, it involves a few injections, but they're fairly minimal for the most part to people who have been in pain for a long time. And what we find is we only often need 5 to 8 treatments to bring pain down from, maybe an 8 out of 10 to a 1 or 2 out of 10 pain.
So that's pretty much, maybe not being able to function as well in their daily activities and some of the things that they do to really almost being normal.
This treatment is going to change how pain is treated and looked at, I truly believe, in the next 10 years. And, one of my passions is helping people get out of chronic pain. There are a lot of people who are on a lot of pain medications.
And steroids.
and steroids.
So that's, I would like to sort of talk about that as well. Also, you know, what is the physiology behind the steroids and what it's doing to our body, right? And then painkillers as well.
Yes.
Right.
Both the painkillers on a chronically used basis and steroids used chronically have very detrimental effects, not to mention addictive effects.
Right.
And they are not solving the problem.
Right.
If they were solving the problem, people wouldn't have to continue to take the pain medications over and over and over again. Now, certainly, you know, anti-inflammatories are important sometimes for acute pain. Steroids can save a life, but when they are being used for a chronic pain, it is not an answer that I want for anyone.
But I think the misconception behind it is that when people get the one shot of steroids, you know, behind their knee or in their knee, and then the pain goes away for 6 months, you know, they really think they're healed. So that a lot of times stops them from seeking any other treatment or further, you know, natural, like to get this back to normal type of treatment. And then when the pain comes again, they have to start this all over again. By that time, it's gotten worse, really.
Yeah, corticosteroid injections, you cannot do more than 3 to 5 in your life because of the detrimental effects on your bone health. It can cause osteoporosis. Yes, it takes pain away because it stops inflammation, but it doesn't go to the root of the cause.
Right.
And it actually deactivates your immune system. So instead of bringing things to the area that help heal a nerve, like glucose, dextrose, sugar, and the nutrients that are needed to help heal, steroids will actually shut that entire cascade off. And they will actually change the architecture of the ligaments and the tendons.
Yeah, and I think this is a really important point to bring up.
Yes. When I'm doing certain regenerative injection therapies, there are other therapies that I do that, other than the NPT, that are injection therapies, and they're, you know, looking at the ligaments and the tendons, let's say in the knee. You can actually tell and feel the difference between a joint that's had a steroid injection versus a joint that's still, you know, a healthy joint, but maybe it has some injury on ligaments or tendons. There's the tissue integrity has actually degraded after steroid use. And that is a permanent change.
Right, because you can't repair that again. Versus, you know, I'm a true believer in trying to repair these, especially the ligaments and tendons, as much of a natural way. And the whole problem is we don't have a direct blood supply that goes into the ligaments and tendons. And many times, you know, there's a delayed response in healing, and people have such a hard time dealing with the pain and inflammation during that delayed response in healing. And so we resort to doing steroids or painkillers. But really, there are ways, if we really, really wanted to know, to get to the cause of the problem and try to strengthen those areas.
Absolutely. In addition to this NPT, that helps the neurogenic pain, when we start talking about ligament and tendon repair and regeneration, we sort of jump into a sort of different realm of regenerative injection therapy, RIT. And this, we can think of this as more of our classical prolotherapy, although I really like to call it regenerative injection. And that's using dextrose, so the sugar water, the glucose, and procaine, which is a nutritive numbing agent, and glucosamine, which glucosamine is actually a nutrient that some people might have heard of and take orally. We can actually get it in a liquid injectable form. And we actually use that solution to access torn ligaments, injured tendons, and even the cartilage that might be breaking down due to degenerative joint disease. And we actually inject it in specific places at the ligament and the tendon, and that will cause your body to create a influx of healing chemicals and messengers, because exactly what you said, ligament and tendons don't get a very good blood supply after we're born. So then we have an injury and we can't get the nutrients to heal it there. But using this type of injection technique, we get it right to that area, and we cause a little bit of just micro-inflammation, which stimulates our body to send as much resources to that area as possible.
Right, and this is one of the reasons, something as simple as acupuncture works really well, because it brings in all that energy and the blood supply into the area of injury and trauma.
Exactly.
Right, and so how'd you get into NPT?
Well, I learned NPT now about 2.5 years ago, and Dr. John Liftoff has been traveling the world teaching this technique to as many practitioners as he can because of just the profound benefits with non-toxic, non-invasive therapy. And it's healing people. It's not just a Band-Aid for your pain. It's actually healing the reason you're having pain. And he has come to our office twice now to